All right, ready for timeout. Patient's a 21-year-old female who's 5'8", 173 with no known drug allergies. She's here for Vaser Lipo 400, lipo of her arms, retraction to her abdomen, fat transfer to her hips and buttock, and Riblux anterior and posterior rib remodel. The STDs are on and working, correct? Any anesthesia concerns?
No anesthesia concerns.
Any nursing concerns? Any tech concerns?
No.
All right, so today I'm doing revision lipo. This patient's had previous liposuction done before. And what often you can't see under the skin is scar tissue. And so when we talk about scar tissue with previous lipo, you can kind of see how I'm trying to put this cannula through and I'm countering resistance. That's mainly because there's scar tissue or adhesions underneath the skin which really prevent, this cannula from moving freely like it normally does in somebody who hasn't had surgery. So revision liposuction is always going to be a little bit more tedious, going to be a little bit more work because of the previous scar tissue that forms from the liposuction. These areas where I've marked an X here, these are areas where I got to be very careful to do liposuction because she's been over aggressively lipoed before and there's already some superficial skin changes and discoloration from over aggressive lipo in the superficial plane there. So when I get to this area out here, I'm going to be very gentle and do minimal superficial liposuction to avoid any further injury to her skin. All right, so I've completed the liposuction of the front. This was revision lipo. She previously had liposuction, but she still had a decent amount of fat left. So you can see here, I was able to get out probably closer to 1,200 cc's of fat. Now, I had to stop because anytime I do revision lipo, you have a lot of scar tissue and you have more bleeding. And so once I start seeing bloody fat come out, that's kind of like my cue to stop because I don't want to exsanguinate the patient. Even though I use a lot of epinephrine and other meds that help decrease bleeding, at some point, all that scar tissue from previous lipo, you're going to see a little bit of red, and that's just a little bit of blood loss, and so that's our cue to stop.